David, hi, I'm Sam. I can't believe we haven't met. Your parents are some of the most wonderful people in the world, and I'm sure we'll meet someday. I just can't believe I haven't seen them for so long. Anyway, I'm glad you contacted me to do this. I thought to make it easy, I'd just kind of answer your questions in the order as close as I can. I've got them right here on the screen. So, first question you had is what I got my degree in. As an undergraduate, I did a liberal arts and sciences bachelor's degree, and it was very broad. The nice thing about medical school is they really don't care what you do for your bachelor's degree. You can really do anything, and it was great because I could just kind of take a broad smattering of courses and all kinds of things, and it was a lot of fun. Then I went to the University of Utah. That answers your second question for medical school. So I got my MD there. It was a great place to do it, and really enjoyed it. Third question was about how much you make during residency. So I made about 48,000. I think residents are up to about $50,000 a year. So just enough, kind of as an apprentice to kind of live on. So you're not having to take out any more student loans like you did in medical school, but pretty tight with the family. The residency program that I went to was at Harvard University through the Massachusetts General Hospital. So it was downtown Boston, and it was just a wonderful place to go. It was really fascinating because the history of anesthesia was actually kind of born there. Back in the 1840s, the first public demonstration of ether being used for the first kind of anesthetic for a surgery being done was there. And so there's this kind of great history, and they have this place called the Ether Dome, and they have Ether Day each year and everything. So we always joked that the Ether Bunny was going to come. But anyway, that's a whole nother side to it. But anyway, the experience was great there at Harvard. There was a lot of interesting people from all over the world to teach you. You work on one-on-one with them during residency every day. And the next question you had was how many years of education. So I did 4 years of med school. I kind of took a sidetrack for a year because I had a lot of interest in preventive medicine, so I did a master's in public health. So that was an additional degree I did. And then I did 4 years for my MD, and then another 4 years for residency. So it was about 13 years, but worth every bit of it. I mean, it was all very interesting as well. The sixth question you had is, did I prepare with any AP classes? Yeah, I took 3 or 4 different AP classes, and even though they weren't directly related to medicine, they helped just because they kind of got some general education credits out of the way. So that way I got my degree in 4 years, but I didn't have to take as heavy a load every semester. I could take fewer classes so I could focus on them better, and that way I'd have more time to try to make sure I get a good grade and that kind of thing. Since of course med school is fairly competitive, so that helped in that way quite a bit. How early did I decide? Well, I was a senior in high school, and I just had starting to college when I graduated as an art major actually, but my father died that year of a malignant cancerous brain tumor, and the neurosurgeon who took care of him during one of these times actually, after one of his surgeries, he spent like 45 minutes with me showing me some CT scans and all these kinds of things regarding the surgery, and I really was fascinated and just decided that this is just such a neat area. Neuroscience in general is really fascinating, and so ended up doing neuroscience research actually in med school after for some time, and really was enjoyable. So that's kind of what propelled me into it. But I really wasn't sure if I was gonna. It's hard for me to give up art and even architecture, and so because I had a lot of diverse interests. So it wasn't actually until I got off my mission when I was about 21, and I was about into my second year in college, that I decided for sure I was going to go to med school. And then I actually kind of sidetracked toward this master's degree for a while, and then came back and applied to med school after. So, so I did plenty of things to keep it interesting. Do I enjoy my job? That was your 8th question. I'll kind of combine that with number 10, which is what are my favorite aspects of anesthesia. Yes, I really enjoy my job. It's a fantastic job. It's really hard to beat because, number one, I'm my own boss. I mean, I have a lot of autonomy. Nobody's kind of looking over my shoulder. I kind of do everything ethically and professionally the way I think that ought to be done. And one of the great things about anesthesia is, and there's a lot of things that most of the people in the world don't know what we do, but there's also even a lot of physicians who don't even understand what we do for anesthesia, because it's not just about putting people to sleep. That's just one part of it. We do that's considered general anesthesia. We do a lot of regional anesthesia, particularly here at the hospital I'm at, and that's like putting just part of the body to sleep. So just a leg, or um, just an arm or a hand or something like that. So if somebody were having hand surgery and it was an elderly person and we really didn't want to put them to sleep because it would be dangerous, I might put an ultrasound here and look at the nerves in their neck and find a place to inject local anesthetic to numb up just their hand or their arm for the duration of the surgery, or to give them post-operative pain relief. So there's a lot of that kind of thing. Epidurals in people's backs. It's not just for women in labor. I did one the other day for a guy who's 20 years old who fell rock climbing like 20 feet and broke all his ribs on this side, and he could hardly breathe. In his case, an epidural it can be almost life-saving, because it'll allow him to, if I put it in high in his back, then he is all numb across here, and then he doesn't feel all the pain when he takes a deep breath, so he can continue to breathe. So there's a lot of interesting regional anesthesia that we do. And then I'm also part of a small sub-team called the cardiac anesthesia team. So I'll do anesthesia and keep people alive during open heart surgery. But it's more than just keeping them alive and giving them blood transfusions and giving drugs to help keep their heart rate up or down, or their blood pressures, at a specific point. It's also giving the surgeons information to help them with the surgery. So I'll put an esophageal, meaning a echo probe that goes down through their esophagus, and it looks at the heart from inside, and it's an ultrasound echo probe, and it'll basically tell us what's going on with the heart, and it's how it's functioning and how the blood's flowing through it and everything else. And then I'll tell the surgeons, hey, they've got a problem with this, maybe we need to fix that, or we need to look at the repair and maybe go back in or something like that. So it's a kind of a dynamic part, and it's very interesting as far as ongoing management of things people don't normally know that we do. So, and then we take care of little infants and babies one day, and the next day it's 80-year-old people, and one day it's one area of surgery, and another day it's a completely different area. And then I'll do some critical care. We'll also see patients several days after surgery and do a lot of pain management. So it's actually very broad exposure to medicine, so it actually stays very interesting. One of the great things about medicine, and in particular, and anesthesia in particular, is I've been doing this for about 10 years. I've probably taken care of about 10,000 patients by now. And I can tell you that every week, almost, I see something completely new I've never seen. Either a disease or a patient combination that just is really unique. So it stays interesting. You're not going to get bored on this kind of job, and it's always challenging. And so very interesting area. Also, we act a lot as consultants to other physicians, to surgeons and things regarding patients' ability to undergo surgery successfully or safely. So a lot of interesting things going on with new technology too, and anesthesia is a very kind of technology-driven field. We have lots of computer-generated things and gadgets and devices and stuff to make things really safe for patients, so it's kind of fun. I've practiced in Hawaii and Massachusetts and Utah and in California, so quite a few places. I think that answers all your questions, and yes, you're free to quote me on any of this stuff, and please just email me again if you have any questions, and I'd be happy to answer them. So glad that you contacted me. Thanks, David.